Dear friends, today Dr.MedExedu Indian Medical Society is going to start two subjects, that is psychiatry and forensic medicine. So let's begin our first question. Let's begin our first question. Yeah, first question is, yes, this is our first question. Which article of Indian Constitution confers a right to life on the Indian citizen of India? Which article? Option A, Article 11. Option B, Article 21. Option C, Article 23. Option D, Article 25. So, what is the answer of this question? That is B, Article 21. There is another question. It is very highly expected question. Prohibits human trafficking and forced labor. Which article? That is Article 23. Freedom of religion, Article 25. Freedom of religion. Okay. Come to the another question. Question number 6. A mother reported that her daughter ingested a substance in an unknown dose. The girl presents with hypertension, tachycardia, mydriasis, hyperthermia. What is the likely substances? Option A, heroin, morphine, cocaine, chlorpheniramine. Option D. What is the answer? So answer is cocaine. Why cocaine? Because cocaine is a sympathomimetic drug. Cocaine is a sympathomimetic drug that causes hypertension, tachycardia, mydriasis, pupil dilation and hyperthermia due to excessive norepinephrine and dopamine release, which is already given in the question: hypertension, tachycardia, mydriasis and hyperthermia. That is, answer is cocaine. Okay. So here in this table there is a key effects and the substance. Which substance causes hypotension, bradycardia, meiosis, pinpoint pupil and hypothermia? Okay. So which substance? Yes, you are right. Heroin. Okay. Heroin. Similar to heroin, which substance similar to heroin? Morphine. And it causes respiratory depression and meiosis. What is the next substance? Yes, this is already mentioned in our question. That is cocaine. Okay, cocaine. Yes, next one, anticholinergic, causes tachycardia, hyperthermia, mydriasis, but less hypertensive. Which substance? Chlorpheniramine. Chlorpheniramine. Okay. Yes. Let's move to next question. Okay. Question number 3. Question number 3. Yes. A patient was brought to hospital after road traffic accident with symptoms of confusion, irritability and tremors. He has history of consuming alcohols daily. Which of the following drugs used to avoid withdrawal symptoms? Yes. Option is A, fomepizole. Option B, naltrexone. Option C, lorazepam. Option D, thiamine. Which option? Yes. Option C, lorazepam. Option C, lorazepam. Why lorazepam? Because lorazepam is a benzodiazepine, is a first line drug for alcohol withdrawal to prevent seizures and delirium tremens by acting on the GABA receptors. Okay. So, primarily used Which substance is primarily used for methanol or ethanol glycol poisoning antidote? Okay, fomepizole. Fomepizole. Okay. Long-term alcohol craving reduction. Long-term alcohol craving reduction. Which one? Naltrexone. Okay. Acute withdrawal symptoms control. Acute lorazepam. Okay. Wernicke encephalopathy prevention and a key supportive role in the alcohol withdrawal treatment. The substance thiamine. Okay. Come to the question number 4. Come to the question number 4. Come to the question number 4. Untreated ADHD persisting in a childhood increases the risk of which of the following in adolescence? Okay. So first of all, you should know what is ADHD. ADHD is attention deficit hyperactivity disorder. This is a neurodevelopmental disorder features persistent in attention hyperactivity and impulsivity that interfere with daily functioning, often starting in a childhood. ADHD persistence often co-occurs with oppositional defiant disorder, that is ODD, progressing to conduct disorder and increasing juvenile justice involvement. Come to this box, and this is associated with untreated ADHD. Anxiety related uncommon link. Selective mutism. The option A is selective mutism. Okay. A strong risk, that is ODD change to CD progression. Okay. Conduct disorder. What is ODD? ODD is oppositional defiant disorder. See, conduct disorder. Okay, conduct disorder. C is recurrent episodes of consuming large amount of food rapidly, often feeling out of control, without compensatory behaviors like purging. Purging, you can take it out, the food also, but this is binge eating. Maybe you people know it. Binge eating disorder. Binge eating disorder. Okay. Typically in younger children. Separation anxiety. Separation anxiety. Anxiety disorder. Okay. Anxiety disorder. Come to our last question. Okay. Come to our last question. A 24-year-old male, very calm and handsome. He behaves well in front of the psychiatrist, but engages in fights, breaks rules. He and has a police case. What is likely diagnosis? What is likely diagnosis? A is narcissist personality disorder. B is paranoid personality disorder. C is schizotypical personality disorder. D is antisocial personality disorder. So this is antisocial. Why? Because the psychiatry, he is very good in front of the doctor, but engages in fights and break the rules. That is antisocial. Okay. Thank you very much for this class. We had questions of forensic and psychiatry together. I hope you people will enjoy. Thank you very much. If you like it, share with your friends. I hope you people get some benefit from my questions and explanation. I hope, I pray for you people pass the FMG exam. Thank you very much.